just want to focus in particular on paroxysmal atrial fibrillation. Diraj, this is an arrhythmia that creates quite a lot of confusion for us in primary care. It seems to me the evidence, if anything, is even stronger for catheter ablation in these patients. Do you agree? Give us some really simple guidance here. Do you agree as a default that all patients with paroxysmal AF should at least be considered for a referral for assessment for ablation? So not necessarily being offered, but at least being referred and considered.
Yes. Once again, I will go back to the guidelines on this because the guidelines have been written based on lots of published evidence. There is no question that the results of catheter ablation are best in paroxysmal atrial fibrillation or early persistent atrial fibrillation. As in most other conditions in medicine, the earlier you pick it up, the earlier you intervene, the better your results will be. And catheter ablation is no different. So when you come across a patient with paroxysmal atrial fibrillation, it is your opportunity to intervene before it gets too late. I almost think, it may be harsh words, but I almost think it is dereliction of duty for us to sit on these patients and not refer them on, especially when the evidence base has moved on so much. Because the next time you see them a year later, they may have been in persistent AF for a year, and then the horse may have bolted. So if you've got a patient with paroxysmal atrial fibrillation, especially if they have symptoms referable to that, please do consider referring them to a specialist early.